Hello, everyone. We are joining you now with some breaking news. Governor Greg Abbott has declared a statewide public health disaster. That's after 39 cases of COVID-19 were confirmed in Texas. We're also told by the governor that 75 other people are still being tested.
Meanwhile, President Trump expected to declare a national emergency here in the next few minutes. But here in West Texas, health officials, school administrators, law enforcement, and city and county leaders are all coming together for a press conference to brief the community. News West 9's Tatum Gwen is there.
Tatum, what's the atmosphere like?
The health department will continue working closely with the Texas Department of State, the State Department, and follow the guidance from the Center of Disease Control and Prevention, along with our active engagement with local hospitals, emergency responders, healthcare providers, and other essential community partners who all play huge roles in our ongoing efforts to ensure the safety of our community. At this time, I'd like to turn it over to our epidemiologist, Amrinder. He is with the health department, and he has been monitoring the coronavirus and working constantly with the reliable state sources and our local health care providers.
Thank you, Brandy. I'm going to be talking about our job responsibilities that we have been doing in the health department in the community. So the Ector County Health Department is closely monitoring coronavirus disease situation in Ector County. We continue to coordinate our local, regional, and state partners. Ector County Health Department activities so far have included monitoring any persons under investigations, or we call them PUIs, arranging evaluations for them and coordinate testing, collaborating with hospitals and providers to quickly identify any persons under investigation, and sending out timely and accurate information in the form of guidance documents and information updates. At this point, there are no confirmed cases in Ector County, and the risks to residents remains low. If a positive case of COVID-19 is confirmed, the health department will provide communication to the public and media. The population at elevated risk is elderly population with comorbid conditions. So if you develop fever and symptoms of low respiratory illness like cough or shortness of breath, within 14 days of travel to areas where COVID-19 outbreak is happening, you should call ahead to your healthcare professional and mention your recent travel or close contact. Your healthcare professional will then assess you to determine if you need to be tested for COVID-19. The CDC does not recommend people who are not sick to wear face masks to protect themselves from the respiratory viruses. These face masks are designed to contain your respiratory secretions and not to filter the air that you breathe. So it would be more helpful for people who are sick so that they can protect others from being infected. The testing is now available at 2 large commercial labs, LabCorp and Quest Diagnostics. So physicians now do have the ability to order tests at their discretion based on their clinical judgment and exposure history of the patient. Meanwhile, at the health department, we are continuing testing at our public health lab in Lubbock. Any positive test results from the Lubbock lab would be considered presumptive positive, and those presumptive positive will be confirmed by the CDC. Currently, there are no vaccines available to prevent coronavirus disease. However, there are certain steps that we usually take to prevent the spread of flu and common cold that would also help to prevent coronavirus disease. And they include washing your hands often with soap and water for 20 seconds. If not available, use hand sanitizer. Avoid touching your eyes, nose, or mouth with unwashed hands. Cover your mouth, nose with a tissue or sleeve when coughing or sneezing. Avoid contact with people who are sick, and stay home while you are sick, and avoid close contact with others. Thank you. Now I will hand over to the Chief Nursing Officer from Medical Center Hospital, Kristen.
Good afternoon. With the current concern for the COVID-19 that we've discussed, our community hospitals are meeting on a regular basis to ensure safe care of our patients, our staff, as well as the community, all in conjunction with the health department. So some of the things we've coordinated we wanted to make you aware of. We are having weekly calls to prepare our facilities and to ensure that we're all doing the exact same thing according to CDC guidelines. So every week the hospitals do have a facility call to work through any of those CDC guideline changes so that we're prepared for anything that we need to fix on our side. We are having internal weekly meetings at our facilities just to deal with stress of operations, our supply issues, and any of the medication issues that we foresee coming to us. We also are closing entrances. That's a new thing that we've done this week. And that's really to enable us to screen visitors properly before they come into our organization. We're asking screening questions according to CDC guidelines, and moving forward, you'll be seeing us taking temperatures. So what we ask the community is just your compliance and understanding. It takes a little bit of a process to see every person that walks through our facility doors. I know at Medical Center alone, yesterday we saw 1,150 people. So there's a large population that comes to visit, and we want to ensure that you're safe just like our patients are. So please, we do ask from both facilities that you are compliant with the questions and anything that we're asking you to do, even if that means we ask you not to visit. One other thing we're doing is eliminating internally with our hospital staff, travel, unnecessary meetings. We hold a lot of community events at both facilities. So we are eliminating those just because we don't feel like those are essential to patient care, and that's what's most important at this time. The other thing we're doing is coordinating with our county officials because we do have an emergency management plan in place. Both facilities coordinate with the city as well as the county to ensure that proper resources are here. We're all doing the same thing. We're all on the same page. So we are working on making sure that we're compliant with everything that the county has for our emergency management plans. So now I'll turn it over to Chief Alvarez with the Odessa Fire Department.
Thank you. Good afternoon, ladies and gentlemen. As for Odessa Fire Rescue, during a large-scale infectious disease outbreak, such as the COVID-19, Odessa Fire Rescue will find it necessary to make the adjustments in our daily operations and our staffing within the department. The objective of this plan is to minimize the negative impact on the health and wellness of our personnel, their families, and the citizens of our community. So in our initial action plan, what we're going to do is, number one, we're going to minimize the risk of infection to our personnel and their families. Number two, continue to provide essential services to the community. Number three, we have to gain and maintain situational awareness, and we're doing that through our emergency management, and that's through the State Operations Center, where we're getting daily updates from them as well. Our personnel are trained. Our personnel have the proper equipment for this type of response. We do have two patient isolation devices, which are called isopods. We do have two of them, and we are going to strategically locate those in certain ambulances and certain stations. One of the things that the public does, if they make a phone call to 911, call 911, they're going to be asked certain questions, additional questions, so we can start that screening process so our personnel know if they need to wear an N95 mask and those other extra precautions. So we're doing that as well. We do have some procedures in place for the nursing homes, where we respond to the nursing homes. If they have a contaminated patient, then we're going to ask them to bring that patient to us instead of us going inside the nursing homes. More than likely, one of the things that we'll also do is scale back on our public education, public outreach. I'm going to ask the public that please don't come to the stations with large crowds, with a lot of people. And also, one of the things that we have annually is our open house and our fire prevention week. So we're probably more likely going to be canceling that. So this time I'll turn it over to Dr. Scott Murray.
Good afternoon, everybody. Scott Murray, Superintendent ECISD. In working very closely with Ector County Health Department, our city leaders that you see here, local medical experts, and with their full support, we are making the decision to open all ECISD schools on Monday. There are no cases of the coronavirus, COVID-19, in Ector County at this time. And we understand that this situation changes daily, and we may adjust these plans based upon any new information that we receive. Our health and medical communities are preparing for the illness to reach our community. And at this time, there are no illnesses. At this time, they are recommending that our schools maintain regular operations. Medical professionals agree most who contract the illness will have mild symptoms. Elderly patients and those with underlying health conditions are most at risk of the severe illness. We will be giving close attention to our most fragile populations who may be at higher risk in ECISD. As a measure of safety and effective immediately, the following actions will be in place. All non-essential travel for staff and students is canceled or postponed until further notice. This includes athletics, fine arts, academic contests, and conferences. Second, all non-essential gatherings, events, and meetings are canceled or postponed until further notice. This includes PTA meetings, booster club meetings, and community meetings. Third, all non-essential visitors and guests will be restricted from visiting our campuses until further notice. This includes non-essential volunteers and mentors, parents eating lunch with children in the cafeteria, and others. Before spring break, ECISD custodians began above and beyond cleaning at the end of each school day, with a special focus on touch points like door handles, faucets, sinks, desks, chairs, and tabletops. That work continued with more cleaning during the spring break period and will continue as we place soap in all restrooms and ensure that it is maintained in all restrooms in ECISD, and spray bottles containing a bleach solution will be located in each of our classrooms. We will continue to follow the recommendations made by the Centers for Disease Control and the Texas Department of State Health Services, as well as our local leaders and officials. We are encouraging all students and staff to stay home if they are sick. The most common symptoms of the coronavirus are flu-like symptoms: fever, cough, sore throat. Again, we are encouraging students and staff with any of those conditions to remain at home. If you have these symptoms, health officials recommend that you call your doctor and avoid contact with others. We recognize as a school system that this is an evolving situation, and we will be flexible with our decision-making as we receive any new information or guidance. We will continue to work with our local, state, and national leaders, as well as our local, state, and national health organizations, to keep you informed and to keep you safe. The health of our staff, our students, and our community is our top priority. Thank you. Mr. Mayor.
As your mayor, I continually closely monitor the threat of novel coronavirus, now officially known as COVID-19. There are no confirmed cases of COVID-19 in the city of Odessa or Ector County. However, this is a rapidly evolving situation. With the ever-changing situation in the coronavirus, the leaders of Odessa have formed the Odessa Coronavirus Task Force. This task force will be meeting on a weekly basis to make sure that we are all on the same page and we know what's going on in each other organization. Public officials indicate that there will likely be more U.S. cases in the days and weeks to come. If a case is confirmed in Odessa, we are ready to respond. The Ector County Health Department routinely investigates and contains infectious diseases and is well prepared to handle the case of COVID-19. Although this is an ever-changing situation, this is not a time to panic. If you have not been around anybody with COVID-19 or have not visited an ongoing outbreak area, you are currently not considered to be at risk. I propose Odessa being an example for the rest of the country to help flatten the curve of the COVID virus. That means avoiding non-essential gatherings. There are several city events that will be canceled. We have decided in the best interest of safety, health, and well-being of the public to cancel the Spring Fling events scheduled on April 11th, 2020 at UTB Park due to the threat of coronavirus. In the Spring Fling includes the Bunny Hop 5K Fun Run, Easter Egg Hunt, and the Kite Flying Festival. The city and downtown Odessa recently made the decisions to cancel Tap into Downtown out of the abundance of caution. Social distancing is a great tool, as is avoiding large crowds. There are additional ways to combat the spread of this disease. People should also practice routine, healthy hygiene habits to prevent the spread of the illness like COVID-19, such as washing hands frequently, covering for coughs and sneezes. Avoid touching your eyes, your nose, your mouth, and staying home if you feel sick. I also want to remind the citizens of Odessa, there is no need to go to the emergency room unless you have a medical emergency. Emergency rooms need to be able to serve those with the most critical needs. If you have any symptoms like cough, fever, or other respiratory problems, please contact your regular doctor first. And now, County Judge Hayes.
Thank you, Mayor. You know, as I stand here in this room and we are surrounded by great leaders, all of those that are all behind me, from the beginning of an ER doctor all the way over to your department head for our county health department. The mayor and I could not be more proud of those that are behind us and of our community. We are fully aware that at some point our community is going to have a person that is going to test positive. But because that your leaders of your community have been so proactive, for example, on March 3rd, when we all went to the polls to vote, your Ector County Elections Office was already preparing for sanitation and cleaning of your voting machines and had sanitation cleaning jails at all facilities. So we were already ahead of the curve and trying to prevent and protect our community. I want you to know that the majority of the individuals that have contracted the virus are 80+ years old. Those that are in the age of 0 to 9 have not been affected. They have not been affected. So that is one reason why your school system is opening, because they feel that your children are going to be safe going to school. Now, that's not to say that in a week from now, 2 weeks from now, that they might make a change to their school system. But we will notify you of that change. Any change that occurs in your community, you can go to the Ector County website page or the city page to find what events have been canceled or if there are any changes in your community. Now, the governor today announced that the state of Texas is in a state of emergency. Now, that sounds really horrible. Now, I'm not going to try to dumb that down, but I'm going to try to explain to you why he did that. The reason that he did that is because in order for your city or your county to receive any federal funds for any cost that we incur or lose during any shutdowns, events, or cost, we are eligible to apply for federal dollars for reimbursement. So that is why the governor took that stance today to declare an emergency. It's not because that Odessa is in a state of emergency or the state of Texas in an emergency. It is because that allows us to be able to receive those federal funds. So again, I cannot thank those that stand behind me and beside me to protect each and every one of you in our community. I think at this time we're going to open it to questions. Does anyone have a question? Yes, ma'am.
Do we know if anybody has been tested for the virus in Ector County at this time?
I'm going to address that to our epidemiologist.
We are monitoring patients and we are coordinating testing for people under investigation, but we are going to make a public announcement only if we have a confirmed case.
Do you know a number of how many people are being monitored or anything like that?
We only will be talking about the confirmed cases. Thank you.
But you are confirming people are being monitored?
Yes.
And I want to add, the reason that he is only going to tell you when you have a positive case is because that we are still in a flu season. And so there are lots of people within our community that are testing positive for the flu. So if we were to tell the people in the community that we have 1,000 people that are being tested for the flu, that would put panic in our community. And we are just not going to do that to our citizens. We are not going to do that. So that is why we are only going to tell the media and the public and the community when we have someone that has tested positive, because we are still in a full-blown flu season, which is a normal flu season.
Are there any testing protocols for people coming back from vacation, maybe through the airport right now?
That would probably be a Midland question, because that's Midland International Airport.
At this time, we're unaware of any.
The CDC does, however, give guidelines of people that are traveling from various areas of what testing, the screening and testing that may need to occur based on where they're coming from. So again, whether it's Midland or the airport or any travel, whether they're flying or not, they're going to be following those CDC guidelines.
Yesterday, you probably heard that Texas Tech University is not allowing the students to come back. What happened is they went on spring break. So who and where they went, nobody knows. So that's a precautionary measure. So that's why the students are not coming back from the spring break. It's a different situation. Also, we have some workers and some of the faculty and some of the staff who went and took some cruises around the world. Those are not allowed to come back to work. They have to self-quarantine themselves until symptoms are manifested, and then we go from there. The self-quarantine should be around 14 days. Additionally, it's very important to clarify that we have a plan into place when you call your doctor. What happens when you call your doctor? Somebody is going to screen you to find out, first of all, if you have one of the issues that cause you to be concerned. Second, if that is the case, for instance, you went to Italy and you came back, then the second step is to find out. You can stay at home, and then from there, if you have mild symptoms, that's the way again to stay at home. If you have moderate or severe symptoms, then the physician that is in charge of you is going to decide if you need testing or not. According to the CDC, everybody who is sent by a physician to be tested is going to be tested. So I think that clarifies some of the difference that you have seen today regarding age, basically.
And related to that, University of Texas Permian Basin, as you saw yesterday, expanded our spring break by 1 week. The purpose of the expansion was not that our university is unsafe for students. Obviously, we know, as we've talked today, that there are no confirmed cases right now, and things are progressing, in that way. The reason that we expanded our spring break was really to make sure that our faculty can come back and to come up with very contingency academic plans in the event in the future that we have to go online. So I think, as you look at the educational institutions across the state, there are a myriad of plans that institutions are putting in place, and most of the plans are those preactive, cautionary ways to put us in line to be able to act quickly if we need to make a different decision. Thank you.
There was one point that we did not cover, and that is our nursing homes. Because those that are in our nursing homes are the most vulnerable to catch this disease. So we are asking our nursing home facilities to please go through the CDD questionnaire, which they are, and they are also taking temperatures of those that are coming in to see their mom or dad or their loved one. So we would just ask the public to be very
All right, it looks like we lost our signal there, but again, the City of Odessa, Ector County School District Hospitals, Health Department holding a press conference today, wanting to let everybody know that they have a plan in place. They're working together, and they're asking you to not panic. Some of the highlights of this, we heard from an epidemiologist from the Health Department. Right now, he is saying that the Health Department, there are no confirmed cases of COVID-19 in Ector County. However, when we asked them, Tatum Gwynn is there at the press conference, asked the Health Department if anybody in Ector County or Odessa is getting tested. They told us that they are not going to release that information because they do not want to incite a panic. One of those main reasons was because
we're still in flu season. And it's a very active flu season.
It's an active flu season, and so they don't want anyone to panic. They will let us know, the health department will let us, the media, know, and the public know if there is a confirmed case. Right now, there is not one.
Now, the thing to remember here with the testing is that they are doing that testing here in Ector County, but those tests are being sent to a lab in Lubbock, where there they will determine whether or not it is a positive. And in the event that that particular test comes back positive in Lubbock, it will then be forwarded to the CDC, who will then confirm or deny if it is actually a case of COVID-19. So there is a chain of command here with that testing. But again, we have, for this moment in time, Ector County is in the clear, no reported confirmed cases of COVID-19.
Another thing they wanted to let you know today also, there is 2 labs in town as well that are doing testing, and that could come from if you go to your doctor. They are asking you if you have flu-like symptoms, coughing, sneezing, or whatever, to do 2 things. Avoid the ER. That's for people who really need it. They're also asking you to go visit your doctor if you have these symptoms. Your doctor will talk to you and then determine what they need to do from there. So also, if you're going to the hospital at all, we've also been told there's also new protocols. We told this to you a couple of days ago, that they are monitoring people at Medical Center Hospital. If you go through the doors, they're doing controlled access. They will be taking temperatures here pretty soon, and they will be monitoring you. So they're asking for your patience. They may ask visitors to stay away from the hospital, period. So they just want you to be patient. They'll let us know what they need from us. And they also want to let you know, again, they've got a plan in place.
Now, one of the things that you can do yourself, and we've been telling people this for the last few days, is make sure so you can help prevent spreading the virus, is wash your hands for at least 20 minutes with soap and water. Don't touch your face. To cover your mouth when you sneeze or you cough. Avoid any contact with someone who is sick. And if you yourself are sick or feel sick, by all means, stay at home and don't risk sending or getting someone else with whatever symptoms you may be having.
All right, well, Tatum Gwynn was at the press conference and asking questions. We're going to check in with her real quickly. Tatum, what else are you hearing there?
I'm the one that has to go find out is it true or not, and then report back to them. No, just gossip today, no MCH case.
And as right now, there's not any. Now, maybe Monday there might be. Wednesday there might be.
And you
in 2 weeks from now, when we get everyone comes back from spring break and the gestation period has covered, then there might be. The chances go up. But what we're trying to do today is to take that curve and bring it down. And that's what we're really trying to do. So right now, we don't have any cases.
And you're all welcome to call the health department. You can speak to myself or Amarinder and ask if, we got this information, is this true? And we will confirm or not confirm that information.
And the health department is underneath the county. So as soon as there is a case that is known and positive in this county, my office will know. And my office phone number is 498-4100. And so myself or my staff is available to answer whatever questions that you have.
And as hospitals, we do ask that we defer to the health department. We're both getting multiple phone calls every single hour about these. Do you have one? What's going on? And we are deflecting everything to the health department because they are our one source for the county. So anything that we have, any phone calls, we're going to ask you to please confirm or ask any questions to the health department.
And unfortunately, because of the virus, the everyday patients that our clinic sees at the health department is still continuing exactly like with both of our hospitals. So we're limited with staff, and we're trying to spread ourselves as best we can, but this virus and the protection of our community is the utmost importance to our county and to your city. That is exactly what we're trying to do.
Okay. Y'all are welcome to come up and get interviews.
Good job.
All right, that was a press conference that just concluded. We want to mention a couple of other things that happened during this press conference if you're just joining us. The Ector County School District is taking some precautions at the schools. They are going to be not having any PTA meetings. There are going to be parents who want to come in and have lunch with their kids. They're not going to be allowed to come in. They're really trying to do controlled access, but they will be at school on Monday. And one of the main reasons is because we do not have a confirmed case of coronavirus here.
Now, with all that controlling things that they're doing at ECISD, even though they are having school, a lot of, or if not all, of the unnecessary travel has been canceled. That means sports activities, band, choir, one-act play, all things of that nature is considered unnecessary travel. So those have been canceled, at least for now. And when it's deemed safe again, that will be reinstated.
One of the other things they said is that even before this really blew up, that they have been disinfecting a lot. They've been disinfecting door handles. They've been going to bathrooms and putting soap in. They have a bleach solution in the classroom. So they're going the extra mile, rather, to keep those classrooms clean and to kind of control who's coming in and out of the schools at this time.
That's right. Okay, now we're going to send it back to Ector County. Tatum Gwynn has been there for that press conference. Tatum, what have you taken from what all these officials have said so far?
Hey, Crystal and Victor, yeah, this press conference just wrapped up moments ago. I kind of want to recap a few of the highlights that are coming out of this press conference. The major one being there are no confirmed cases of COVID-19 in Ector County. Every single official that spoke was very adamant about that. Something else to note, they say that they are monitoring a number of people. They would not give a number on that, simply because the only information that the county wants to give out right now is if somebody is confirmed to have the virus. And again, right now, that is just simply not the case. Something else to note, Ector County ISD has made the decision to go ahead and continue as business. Classes will resume Monday. Superintendent Murray took to the podium to say that, we feel that our school children are not at risk because there are no confirmed cases in Ector County. So we're going to go ahead and make that decision to let them go ahead and continue school as normal, though they're going to remain very flexible. That's going to be fluid. So in the event that a case is confirmed in Ector County, they would go ahead and make any changes. A few things that they did go ahead and change. They are not doing any non-essential travel, so that means any extracurricular activities, professional travel, athletic events, any large-scale events also canceled. Everything canceled until further notice. Also, people visiting campuses, so that includes guests, that includes volunteers, that also includes parents that like to go to campus and share lunch with their students. That's not going to be allowed for the time being. Let's see, there was quite a lot. We had about 5 or 6 officials get up and give an update on what they are doing. Something else that Mayor Turner said is that as of this week, they have started a coronavirus task force. This is made up of community leaders in the area, and they are meeting weekly to talk about their current situations, their preparedness, their needs, whatever that might be, and also keeping a close eye on CDC guidelines if those were to change. So a lot to go through here. They've opened it up to interviews, so we're going to see if we can perhaps talk to a few of those people. And so I'm just going to go ahead and send it back to the studio, to y'all.
All right, thanks, Tatum. And again, join us tonight, 4, 5, 6, and 10. We'll have more on this press conference. You can also check out our website, newswest9.com, and our Newswest 9 app.
All right, and the biggest takeaway right here so far, no cases of confirmed COVID-19 in Ector County, so that is in itself some good news.
All right, thanks for joining us, everyone. We're going to return you to regular programming.